We're here in San Diego at the 2016 American Society of Hematology Conference, and joining me this afternoon is Dr. Kolibaba. Good to see you.
Good to see you.
So you are from the Compass Oncology group in Portland, Oregon, and you're involved in a number of exciting studies. And boy, the science that's been communicated here at this conference has just been over the top great. It's a very exciting time for oncology and for cancer patients. And you have a couple of studies that I want to talk to you about. The first one is around the area of mantle cell lymphoma. You presented on a phase 2 study, some very exciting things going on there. Tell us about the study and what you're finding. What are some of the results you're seeing?
Sure, so let me tell you a little bit about that molecule. It's a SYK inhibitor.
Yep.
So it's one of those tyrosine kinases, that's the kind of enzyme that it is, that's in the signaling pathway for B-cell malignancies. And so this is a very special drug that has easy on patients, is really what makes it special. So it has a great safety profile. It's twice a day, but is been very safe and well tolerated. And we've looked at it in this large phase 2 study in CLL, in mantle cell, follicular lymphoma. So this was a report on just that mantle cell lymphoma cohort. And many of the patients had had many previous therapies. And because it was well tolerated, even in groups who had been beaten up a little bit by some of their previous treatments, they were able to stay on study. The response rate was only 18%, so it's not as high as we'd like to see in order to continue to work with it as a single agent. But because of that great safety profile, with some people still on it after 22 months.
Wow.
Yeah. It will be combinable with other therapies, so that's where that drug will be going.
Okay. Combinable with other therapies. I've heard a lot about combination therapy, about personalized medicine.
Right.
Tell our audience of patients and caregivers, when we talk about combination therapy, what is it we're talking about?
Right. We're talking generally about adding drugs in different classes that work differently on a cancer to deliver that 1-2 punch to really get the cancer without causing harm to the patient. So even our old-fashioned chemotherapy combinations were sort of around that principle, but they had a lot of overlapping toxicities. But we still use for lymphomas of all kinds and leukemias the idea of combining the treatment strategy, damaging the cancer in different areas so that we can get better and more durable results.
So the old line of treatments for cancer, a lot of the chemotherapies, unfortunately, a patient would be injected with chemotherapy and it would target the cancerous cell, but it would also damage some of the good cells around that cancer cell, right? And so now with some of the new science, we're really able to hone in and really, come down and really precisely target that cancer cell and preserve the good cells around it. Do I have that right?
Oh, you do, and this is a great example of that. So the molecule was first known as GS9973. Now it has a generic name of entospletinib, and people have no nausea, no hair loss.
Wow.
They really have been able to lead good quality lives, and I've had several patients in my practice on that molecule.
Wow.
And they've been sad to have to move on to something else.